Namaste, good morning. Welcome to Times Health Plus. I'm Dr. Sneha Rathi. I'm a musculoskeletal physiotherapist and a certified yoga teacher from the Yoga Institute, Santa Cruz, Mumbai. I combine the techniques of physiotherapy and yoga and give the best results to my patients through them. So, by far, we have been discussing a lot about the different joints, muscles. Okay, what exactly, how do we work it out? How do we strengthen it? How do we create mobility? Okay, but today we are going to discuss about one of the most undermined topics, okay, which is also equally important as is activity, and that is how to get better sleep and relaxation. Okay, so today we are going to discuss about how to make a yoga protocol, okay, before bed that is going to actually help you sleep better and relax better. Now, before we go on to that, let's first understand why is it so important to sleep well. Okay, so I'm sure all of you know that a lot of resetting processes of the body goes on when we go off to sleep. So throughout the day, our body is working for us, our brain is working for us. We are thinking about certain things, we are planning, executing, using a lot of our organ systems. But sleep is the time when it gets the required rest from all these activities. Okay, so it has been serving us throughout the day. It's very important to give it rest. Okay, so rest is the time when some of the major functions of the body are in the reset mode. Okay, so they are actually balancing the hormones. Okay, there is a lot of repair that is going on within the body, like the muscle tissues are getting repaired. Okay, throughout the day we have been using the muscles and the joints. Okay, all the repairing part or the healing part is occurring when we are fast asleep. Okay, so that's why relaxation becomes so important. All right, then there is also basically the regeneration of immune cells that is taking place. Okay, so our immunity is also getting strengthened. There is consolidation of the memories that we have been collecting throughout the day, so we are actually regulating all the memories that we have collected throughout the day. Okay, so that is why, so you understand how important sleep is. Okay, it is a gateway to actually prevent lot of chronic diseases. It is known that people who sleep well, they are at less risk of getting some of the chronic diseases. Okay, and those who are not having adequate sleep, okay, they are at more risk of getting some chronic diseases. So that's how important the sleep is, and which is why we also need to prepare for sleep. As we prepare for other important activities of the day, it is also very important to start preparing for the sleep well in advance. Okay, so as your day is going towards the end, it's important to prepare for the sleep. We are going to discuss about what are the things that you can do to prepare for sleep as well. Okay, and what is the right way to relax. All right, but before that, let's also understand. Okay, so what are the important three important factors that I'm going to tell you, okay, that you have to do primarily before you are going to sleep. There is something called as a 3-2-1 rule. Okay, that is nothing but 3 hours before sleep, you should have your dinner or your meal 3 hours before sleep. Okay, so that's because the entire digestion should take place and then you should be ready for rest. Your body should be ready for rest. If you are having a late dinner, a late meal, then your body is actually working to digest the meal, and that's why it's not in a complete state of rest. So that's very important that you at least keep a gap of 3 hours from the time you have had your meal to the time you are sleeping. So that's the three. The next thing is the two. Okay, that is nothing but 2 hours before your sleep, you should have all the fluids that you want to have. Okay, now why that is important is if because you have the fluids later during the night, okay, or just before sleeping, then it might lead to some disturbed kind of sleep because you might have to go to the washroom to evacuate your bladder. So that's very important that you try to consume the fluids 2 hours before sleep. Okay, so consume the fluids 2 hours before sleep. That's two. And the one is nothing but stop using all the screens 1 hour before sleep. Okay. So be it television, be it laptop, be it your cell phones, okay, any screen that you are using, try to not use it 1 hour before sleep. That's because when we look at the screens, our brain is quite active. Okay. And if you are giving the brain the signal to be active, then how will it relax immediately as you go off to sleep? So that is why this 3-2-1 preparation for going to sleep becomes very, very important. I'm repeating the 3-2-1 rule once again. The three is try to have your meals 3 hours before you go to bed, okay, so that your body can digest the food properly and it is ready to rest by the time you go to sleep. Try to have the fluids 2 hours before the sleep so that your sleep becomes uninterrupted and you can sleep peacefully through the night. The 1 hour is try to not use the screens 1 hour before sleep. So you just shut off all the digital equipments. Okay, you keep them away 1 hour before sleep so that your mind is not running and active as you are going to rest through the sleeping time. All right. So this is the 3-2-1. This is the primary rule. So first and foremost, we need to follow this. As I have seen lot of patients telling me that I don't get sleep, but when I try to ask them what do you do just before sleeping, so they normally say I scroll the social media sites or I'm on my phone. Okay, so that's like a screen time, so you're not actually giving any signals to the body that it needs to start to rest. Okay, that's why I say that we need to prepare to sleep. So we start preparing right from the time when we have had the dinner. Okay, so when we have had the dinner, that means now it's going to be the time to rest. So we start preparing for it right from then on. And I'm going to share the protocol, okay, which you can follow right after dinner. All right. Now, before that, let's come on to some things that are very important to understand whether you have had a good sleep or a bad sleep. I know right now we have smart watches which can track what kind of sleep we have had. Okay, it will tell you, okay, how many hours you have slept well, how many hours you have not slept well. But there is also an internal feeling that we have. Sometimes we just get up and say, I have had a very good sleep today. Okay, so how do we know that we have had a good sleep? There are certain signs of a good sleep. The number one is that when you wake up in the morning, you are fresh, agile, positive, looking forward for the day. You're not feeling tired and painful when you get up in the morning. So that's one of the important signs that you have had a good sleep, wherein you are very fresh when you wake up during the morning. So that's one thing that indicates that you have had a good sleep. The second thing, there are no aches and pains within the body. So your muscles feel free. You don't have any stiffness. There are no aches and pains within the body. That is another sign that tells us that we have had a good sleep. Okay. So these are certain signs. And what are the signs of a bad sleep? Okay. So when you wake up in the morning, you feel tired, fatigued, despite having rested throughout the night. Okay, so that's one of the signs that shows that you have not had a good sleep. The second thing is you might have had a short sleep. So what happens, sometimes people complain that I woke up in the night and then I was unable to sleep. So a shorter span of sleep. Maybe I woke up at 2 in the night and then I was unable to sleep. So that's another sign of a bad sleep. The third thing is lot of twisting and turning movements within the bed. So you've not had a restful sleep. You have had lot of twisting and turning movements within the bed when you were sleeping at night. You would know that in the morning that I was not resting properly. Okay. So these are certain signs, and some aches and pains within the body or some stiffness within the muscles. That means that we have not rested it out well. All right. So these are some of the signs of a bad sleep. So we can definitely figure out in which category of sleep do we fall. Okay, so this is very important to just every day try to figure out, okay, whether we have had a good restful restorative sleep or it was not that great. Okay, so that we can work towards achieving more and more of relaxation. Okay, so that's very, very important. The next thing is that relaxation is very important because we have had a lot of activity. We are very enthusiastic about doing things Okay, but it's very important that with this enthusiasm comes some balance of resting it out. Okay, so not just enthusiastically working out on our body is important, but a balance of resting it out is equally important, because rest is the recovery phase. So that's why this relaxation becomes very, very important. Now, what we are going to do is we are going to see a protocol wherein we are including some stretches, some movements that are actually going to help us relax better at night. So, I'm going to tell you some asanas, some exercises, some stretches which are going to actually help you relax better. And we are also going to practice the technique that is Shavasana. We are going to practice some pranayams or breathing techniques that are going to make sure that your parasympathetic system is more active and you're going to relax better. Okay, so let's look into that quickly. How we are going to include some stretches in our protocol. So, right after the dinner, when you have had your dinner, okay, we are going to start preparing for restful sleep. So, what we do is we move into Vajrasana. Okay, that's the pose which is very good for digestion. Okay, so what we do is you keep your legs straight, slowly turn your leg under your hip, make a V. Okay, so how is the V? Let me show it to you. So your toes are together and your heels are apart, and you sit in the space between your heels. This is how it looks from behind. All right, so this is Vajrasan. So we try to sit in Vajrasan position for about 5 to 10 minutes. This not just helps with a good digestion because your digestive tract is in alignment, but it also relieves your back of any pain or ache that it has had for a long day throughout the day. Okay, so it eases your back a lot. Okay, that's one thing. If you are unable to sit in Vajrasan with the ankles completely plantar flex, okay, what you can do is you can sit on the edge of the bed, all right, and keep your ankles a little outside the bed. Okay, if this becomes very difficult to sit on your ankles, you can always sit on the edge of the bed and keep your ankles a little outside. That's an easy way. Okay, if you do not have enough mobility of ankles, and if you do not have that much, if you have some pain while sitting on the ankles, it's always good to keep your ankles out of the bed. Okay, you can sit in Vajrasan and just focus on your breathing. Try to keep your back erect. Keep your hands on your thighs. And maintain this pose for some time. You can close your eyes and maintain this pose. Okay, that's a good calming practice to start with. All right. So this is one of the things that we need to do. The next thing is we will start with some basic stretches that are required for the to ease out the body through the day's work. Okay, so what we are going to do, this is not supposed to be done immediately after the meals, but about 1 to 2 hours after the meals you can do these stretches. Okay, so we start with simple neck stretches first. Okay, so that's nothing but the simple warm up techniques that we have been doing. So what we do is take our neck up and down, up and down, 2, up, 3, up, 4, up, 5. All right, now we are going to turn our head to either sides. Okay, so this is also like a check for movements of the body if there is any ache, pain, restriction that has happened. So you can always check that at the end of the day. Okay, so you turn your head towards either sides. 1, 2, 3, 4, 5, 6, 7. All right, now we're going to stretch the sides of our neck. One of the ways to stretch the sides of our neck is to keep your hand behind your body and then slowly just stretch your neck to the opposite side. You can give a slight overpressure on the temple of your head and stay there for 5 counts. 1, 2, 3, 4, 5. You'll feel some stretch on the side of the neck. You do the same thing on the other side. Keep the hand behind, same side, and stretch to the opposite direction. Some slight overpressure with your hand. 1, 2, 3, 4, 5. And come back to the center. Do it on the other side again. 2, 2, 3, 4, 5. Come back to the center. On the other side, 2, 2, 3, 4, 5. Center. Again, 3, 2, 3, 4, 5. Center. On the other side, 3, 2, 3, 4, 5. Center. Again, 4, 2, 3, 4, 5. Center. On the other side, 4, 2, 3, 4, 5. Center. One more time. 5, 2, 3, 4, 5. Center. On the other side. 5, 2, 3, 4, 5. Center. Stretching these muscles out is very, very important because these are one of the commonest muscles which go into tightness with any kind of anxiety, worry. Okay, so that's why stretching and easing these muscles, upper trapezius, becomes very, very important. Okay, the next we are going to just shrug our shoulders. So what we are going to do is just take the shoulders up as much as possible and then relax. Okay, again take it up as much as possible. 2, 2, 3, 4, 5, and relax again. Up. 3, 2, 3, 4, 5. Relax. Up. 4, 2, 3, 4, 5. Relax. Up. 5, 2, 3, 4, 5. Relax. Up. 6, 2, 3, 4, 5. Relax. Up. 7, 2, 3, 4, 5. Relax. Okay, so this is the next one. Now, what we are going to do is we are going to interlock our hands behind the head. We're going to try and get our elbows closer in front and bring it back as much as possible. Okay, so it's kind of a stretching of the chest as well as movement of the shoulders. 2, 3, 4, 5, 6, and 7. All right, so this is the next, so that we are getting some stretch on the front and the back areas. All right, so this is another thing that you can do. Now we can stretch our hands up as much as possible. Okay, stay there. 1, 2, 3, 4, 5, and slowly take your hands down. Now, because throughout the day, if you are in a desk job, you're going to keep your hands like that. It's very important to stretch them up. Okay, so let's do it again. Stretch up. 2, 2, 3, 4, 5. Down. Again. Stretch. 3, 2, 3, 4, 5. Down. Stretch. If you're unable to sit on the ground, it's absolutely okay. You can sit on a chair and do these stretches. 4, 2, 3, 4, 5. Down. Again, stretch. 5, 2, 3, 4, 5. down. If you are doing a right kind of stretch, you will feel the stretch throughout the sides of the spine as well. Okay, once again, 6, 2, 3, 4, 5. Down. One more time. Stretch. 7, 2, 3, 4, 5. Down. All right, so this is the next stretch. Now let's stretch the sides of the spine. So what we are going to do is we are going to bend the elbow, keep your hand on the side and slowly stretch the side of the spine. Stay there. 1, 2, 3, 4, 5. And slowly come back. Do it on the other side. Stretch. 1, 2, 3, 4, 5. Back. All right. If you're unable to keep the elbow on the ground, you can also keep the hand by the side. Bend your elbow slightly and then stretch sideways. 2, 2, 3, 4, 5. Back. On the other side. 2, 2, 3, 4, 5. Back. So here I'm trying to take the stretch from the palm of my hand. Okay, so I'm stretching my hand in a longitudinal direction so that I feel the stretch all through the side of my body. 3, 2, 3, 4, 5. Back. On the other side, stretch. 3, 2, 3, 4, 5. Back. To add on to the stretch, what you can do is you can slightly push the rib cage out. Okay, so this is the movement. So that will add on the stretch and open your rib cage. 4, 2, 3, 4, 5. Back. On the other side. 4, 2, 3, 4, 5. Back. One more time. Stretch. 5, 2, 3, 4, 5. Back. On the other side. 5, 2, 3, 4, 5. Back. All right, so these were some side stretches. Very good to release the stress from the sides of your body. Next, we are going to do some rotations. So you keep one hand on one of the knees, one hand behind, and slowly turn your body as much as possible. Stay there. 1, 2, 3, 4, 5. Do it on the other side. 1, 2, 3, 4, 5. Back again. 2, 2, 3, 4, 5. 2, 2, 3, 4, 5. Back again. 3, 2, 3, 4, 5. Other side. 3, 2, 3, 4, 5. Back again. 4, 2, 3, 4, 5. Back. 4, 2, 3, 4, 5. Again. 5, 2, 3, 4, 5. Back. 5, 2, 3, 4, 5. So these are some easy, comfortable stretches that we are doing. Not trying to go to the extremes of movement, but as much as is comfortable and feels good to the body. Okay, so this is the next thing that we need to do. All right, next what we are going to do is we are going to have the legs straight and lift the hips up one by one. Okay, so we're going to keep the hands behind for support and just lift up 1, 2, 3, 4, 5 and down, and the other side 1, 2, 3, 4, 5. So this is not a stretch but more of a contraction. 2, 2, 3, 4, 5. Back. 2, 2, 3, 4, 5. Again. 3, 2, 3, 4, 5. Down. 3, 2, 3, 4, 5. Down. 4, 2, 3, 4, 5. Down. 4, 2, 3, 4, 5. Down. 5, 2, 3, 4, 5. Down. 5, 2, 3, 4, 5. Down. 2 more times. 6, 2, 3, 4, 5. Down. 6, 2, 3, 4, 5. Down. 7, 2, 3, 4, 5. Down. 7, 2, 3, 4, 5. All right. Now, so this was hip raising. Now, slowly what we are going to do is we're going to point our ankles down and up as much as possible. 2, 3, 4, 5, 6, 7. So up and down pointing. Now what we are going to do is turn the ankle out and in, out and in. Okay, when I'm turning the ankle, I'm not trying to move my knees and the hips as well. I'm just trying to turn my ankle in and out. Okay, 2, 3, 4, 5, 6, 7. It's important to isolate the movements because many a times what happens is, I'm going to show it to you like this. When we are turning the ankle in and out, we are also sometimes rotating the hip and knee as well. Okay, so you need to make sure that you are training your body to understand what are isolated movements. So without moving your hip or your knee, you're trying to turn the ankle as much as possible. Okay, so this is very important. Next is just curling your toes and extending them. Okay, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, so these are some of the warm-up movements, some gentle stretches that we have done. Now we are going to do some routine asanas which you can do. Okay, so what we are going to do is first is Parvatasana. All right, so let me just see before we go on to the asana, let me just see if there is any question. So good morning, Mustaqim ji. Jagdeep ji, what should be the breathing pattern while stretching? So right now in the warm-up, I followed a very normal breathing pattern. I did not focus on any particular style of breathing. It was just a normal breathing. But now that we are going to do the asanas, we are going to follow a certain pattern of breathing, okay, which I'm going to tell with each asana. And yeah. Ree Singh ji, good morning. All right, so let's go on to the asanas. Now, for Parvatasana, you can either sit in Padmasana or you can sit in, if this is not possible, you can sit in Sukhasana. If that is also not possible, if you are sitting on a chair, you can do it on the chair itself. We are going to do Parvatasana and its variations as well. Okay, so let's start with first the normal Parvatasana, wherein you keep your hands by the side. Inhale and take both your hands up. Stretch and elongate your spine upwards. Stay there with normal breathing. 1, 2, 3, 4, 5, 6. Exhaling, bring your hands down, stretching from the side. Okay, since it's elongation, we are going to breathe in when we are elongating and we are going to breathe out when we are relaxing. All right, so let's do it once again. Inhale. 1, 2, 3. Stretch up. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. All right, a very good asana to take away all the stress from your neck, okay, to make your posture better. Okay, it's a very effective asana to practice on a daily basis. Now, once again, now just see at my elbows, they are going to be very straight. My palms are going to be absolutely joined, not interlocking the thumbs at all. Okay, it has to be like this. If your palms are like this or like this, okay, you need to try and modify and bring it them to this position, a proper namaste position. Okay, let's start once again. Inhale. 1, 2, 3. Stretch up. Neck is easy, okay, easy to move, normal, relaxed, straight. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. So many a times when people do Parvatasana, I have seen they poke their neck out. Okay, it's something like this. That's not right. You have to try and maintain the space between the neck, okay, between the chin and the chest. Okay, this space has to be maintained. And then you are supposed to do the Parvatasana. We are going to do it once again. Inhale. 1, 2, 3. Stretch up. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. All right. Now let's go on to the variations of Parvatasana, where we are going to kind of contract the muscles on the sides. Okay. Let's see how to do it. You do the simple Parvatasana first. Now inhaling, bend sideways. Stay there. 1, 2, 3, 4, 5, 6. Exhaling center. Inhaling other side. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhaling center. Inhale and exhaling hands down. All right, let's do it once again. It's going to fixate, activate your core, and we are doing the movement with a fixed base. So it's again a very important asana. Let's do it once again. Inhale. 1, 2, 3. Sideways. 1, 2, 3. Normal breathing. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. And inhale and exhaling. 1, 2, 3. All right. So this was the breathing pattern, and this is how we stretch in Parvatasana. Once again, last time, let's repeat it again. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. All right, so this was something for the sides. Now let's do a Parvadasana variation of twisting also. Okay, so if you want to relax your legs for some time, you can ease it out, move your ankles, move your shoulders to release some tension that is developed with the asana. Okay, again, assume the position of Padmasana or Sukhasana or sitting on the chair, you can do it. Now, what we are going to do is rotation. So let's see. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Again, with a fixed base, we are trying to activate the muscles. Okay, so it's a very good asana to release any tension that has been there in your thoracic area. Okay, so let's do it once again. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. With any kind of spine surgery, abdominal surgery, hernia, you're not supposed to do this particular asana. You have to be very careful with such conditions, okay, while doing any asana. Let's do it once again. Now, it's very common to get a cramp in one of the muscles while doing this asana if you're going way too much into rotation. So try to monitor your rotation. Slowly try to, push yourself into twisting position, okay? Because if some muscles, they have not been working regularly, suddenly they are put into the twisting position, they can go into cramp. Okay, let's do it once again. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. All right, so this was Parvatasana variation. Now let's go on to some stretches for the legs, okay, because we have been walking throughout the day, okay. There needs to be walking or sitting throughout the day. There needs to be some stretches for the inner thigh as well as the hamstrings. So we are going to do Paschimottanasana and we are going to do one more asana for this. What we are going to do is keep your legs straight. Now, keep your hands by the side of your chest. Inhaling, lean behind. 1, 2, 3. Exhaling, bend forward, reach for the toes and stay there. 1, 2, 3, 4, 5, 6. Inhaling, come back. 1, 2, 3, and exhale. Okay, once again, if you have had slip disc, hernia, okay, any abdominal or spinal surgery, you're not supposed to do this asana. Plus, if you have hypertension or any cardiac issues also, please do not perform this particular asana. Let's do it once again. Inhale, lean back. 1, 2, 3. Exhale, bend forward, reach for the toes. Stay there with normal breathing. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. All right. So we are going to get some good stretch on the hamstrings and little bit on the lower back as well. But it shouldn't be pain. If you're feeling some pain in the lower back, that means that there is some instability and we need to work on it first. All right, let's do it once again. Now over here, it becomes very important not to flex your knees when you are bending forward. Okay, not to try and turn your foot in an abnormal way. Try to get it straight up towards you. Okay, all these are important pointers that you need to take care. Let's do it once again. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. So this is like a rhythmic thing to do. Okay. If you're trying to stretch way too much, then the muscle may go into contraction. It's a reflex contraction, and then you may develop some pain. If you do it rhythmically, that is not going to elicit much of reflex contraction. So it's very good to do with counts and rhythmically. All right. So this was Paschimottanasana. Now let's do another stretch wherein we spread our legs wide apart as much as possible. Now slowly what we do is keep our hands behind the head and to try to bend on either sides. Stay there. 1, 2, 3, 4, 5, 6. Come back to the center. Try to bend the other side. 1, 2, 3, 4, 5, 6. Come back to the center and relax. So over here, what we are going to do is we're going to get some stretch on the side as well as the inner thigh. Okay. So this is how you do it. Keep your hands behind the head. Inhale, exhaling. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. All right. If this is very difficult, okay, you can do another alternative wherein you keep one leg outside, one leg is bent. Keep your one hand on the opposite thigh, and now just bend sideways and try to stretch. Stay there. 1, 2, 3, 4, 5, 6. Come back. 1, 2, 3. Now change to the other side. One hand on the opposite thigh, other hand up and stretch sideways. Stay there. 1, 2, 3, 4, 5, 6. And slowly come back. 1, 2, 3. Now the breathing technique over here is, so because we are doing one leg at a time, it might be a little easier than the previous one. Inhaling, bend sideways. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. On the other side, same thing. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. So you have stretched out all the joints almost. Now let's see some asanas in the lying down position. All right. So what I'm going to do is I'm going to turn on the side and lie down, and some simple asanas to relax your body, and we will slowly move into Shavasana. So first is Yashtikasana. It's a simple stretch to the entire body. Inhale. 1, 2, 3. So stretch your hands upward, feet downwards. Stay there with normal breathing. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Once again, inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. One last time. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Now, the next asana is Vipreet Karni. Okay, it's an inversion pose because throughout the day we have been standing, the legs are in the dependent position. It's a good idea to take your legs up overhead, okay, so that the blood circulation is also directed in the opposite direction. There is some assistance with gravity, and the blood circulation is directed towards the heart and the head and the upper body region. Okay, so what we do is we slowly raise our legs up, support our back, and be in this position. The toes should be in line with our vision and stay there. 1, 2, 3, 4, 5, 6. Slowly go down and release your legs. All right. So with the support of your hands, you can slowly release your legs. Let's do it once again. Inhale. Lift your legs and stay there. 1, 2, 3, 4, 5, 6. Another way to release is slowly bend your knees, bring your back down, and slowly relax. Okay, this is another way. If this is not very comfortable, you can always do a leg support with the wall. So what you can do is move towards the wall and keep your legs supported on the wall. Okay, something like this. You can support the wall. legs with the wall and keep your legs there for 30 seconds to 1 minute. Be in normal breathing. And stay there in this position. All right, so this is another way that you can keep an inversion pose for yourself. Okay, next what we are going to do is Pavan Muktasana. So what we are going to do is, it's a Dvipat Pavan Muktasana. So we are going to bend the knees and slowly bring the hips towards the abdomen. Stay there. Point your toes down. 1, 2, 3, 4, 5, 6, and slowly relax and release. Once again, inhale, exhaling. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Slowly inhaling, bring the legs down. 1, 2, 3. One more time. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. All right, so this is some of the relaxing poses that's going to ease your body. Okay, so it's very good to do that. You can also do a simple hamstring stretch wherein you hold your thigh and stretch your knee straight. Hold it for 6 counts. 1, 2, 3, 4, 5, 6. Relax and release. Do it with normal breathing. Stretch. 1, 2, 3, 4, 5, 6. Relax. Once again. Stretch. 1, 2, 3, 4, 5, 6. Relax. Stretch. 1, 2, 3, 4, 5, 6. Relax. One last time. Stretch. 1, 2, 3, 4, 5, 6. Relax. And the other side. Stretch. 1, 2, 3, 4, 5, 6. Relax. All right, so this is what you can do. You can do another leg exercise wherein you lift your leg up and down, 2 and down, 3 down, 4 down, 5 down, 6 down, 7 down. All right, the same thing, you can repeat it on the other side. In Dridasana position, keep your legs straight and lift up. 1, in alignment with your body. 2, not front, not back. 3, 4, 5, 6, 7. All right, so this is also what you can do. Now you can go on your abdomen and just bend your knees to give some good stretch to the quadriceps. So just bend your knees as much as possible and straighten. 2, 3, 4, 5, 6, 7. All right, so this is also a good thing to do. Now we'll go for one of the very important pranayams for good relaxation. That is pranayam number 4, or diaphragmatic breathing. Okay, so this pranayam actually helps activate the parasympathetic nervous system. Okay, so that's why what you do is keep your knees together, keep your feet apart, keep one hand just below the rib cage, just above the navel, and keep the other hand on the ground. Now slowly inhale and exhale. Inhale. As you inhale, Observe that your abdomen is rising up as you exhale. Your abdomen is going down. Okay, try to observe that. Now, you can also give a count in your mind to the breathing. So, inhale 1, 2, 3. Exhale 1, 2, 3. 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 Okay, so this one practice, you do not need to count out loud, but in your mind, this one practice can help you sleep very effectively. Okay, it's a known practice to get a good sleep. So it's a good practice to do before sleeping time. So just before sleeping, you can always practice this diaphragmatic breathing. Now let's go on to one of the relaxation techniques, that is Shavasana. Okay, it's a very important technique. If done effectively on a regular basis, you will learn how to relax your body well. So in this technique, what we do is we keep our legs a little apart, about 1.5 foot apart. Keep your hands a little away from the body. Remove your spectacles or anything that you're wearing. Now slowly we're going to just run through each and every body part and try to relax it voluntarily. Close your eyes and slowly just try to focus on your breath. Relax your toes. Your toes are relaxed. Relax your knees. Your knees are relaxed. Relax your calf. Your calves are relaxed. Relax your thighs. Your thighs are relaxed. Relax your hips. Your hips are relaxed. Relax your abdomen. Your abdomen is relaxed. Relax your lower back. Your lower back is relaxed. Relax your chest. Your chest is relaxed. Relax your upper back. Your upper back is relaxed. Relax your shoulders. Your shoulders are relaxed. Relax your elbows. Your elbows are relaxed. Relax your hands. Your hands are relaxed. Relax your neck. Your neck is relaxed. Relax your face. Your face is relaxed. Relax your forehead. Your forehead is relaxed. Relax your head. Your head is relaxed. Relax your entire body. Release all the tension from the body. Your entire body is relaxed. Now just try to observe the movement of your abdomen with each breath. Just try to observe how your abdomen is rising with every inhalation and falling with every exhalation. Now slowly move your fingers and toes. Bring your legs together. Turn on one side. Now slowly take the support of your hands and you can get up. All right, this was a quick shavasana that we did. Okay, but these are the pointers that you need to remember whenever we are doing shavasana. So these are the areas that you can focus on. You can take your time and try to relax for about 15 to 20 minutes. Only in case of depression, you are not supposed to practice shavasana. Otherwise, Practicing Shavasana can be really very effective on a regular basis to release and relax all the tension within the body. Okay, in fact, it is important to relax your muscles as much as possible. That will take care of your muscle and joint health on a regular basis. Okay, so this was Shavasana practice. With this, I come to the task of the week, that is, you can practice Yogendra Pranayam number 4, that is diaphragmatic breathing on a daily basis just before going to the bed. Okay, try to practice this. Ask somebody to click your picture while practicing this pranayam and upload it on Instagram, tag Times Health Plus. Also, do follow Times Health Plus on their YouTube and Instagram channel for more tips and recommendations related to yoga. Okay, so this was the sequence that you can follow, okay, to prepare yourself to sleep, okay, to relax well. Try to stretch your body a little before bed, okay, and then practice Shavasana and diaphragmatic breathing on a regular basis. Follow the 3-2-1 rule, okay, and see how better your sleep is getting over a period of time, how much you are able to relax over a period of time. Okay, so I hope you're going to practice this, improve your quality of sleep, sleep for at least 7 hours every day. Okay, and make sure that you are restoring your body well, keeping your body in good health with all these tips and techniques. That was it for today. Now I'll see you next time. Till then, stay present, move gently, and make sure that you take care of yourself. Thank you and namaste.